Hello everyone, it's Rafael Gutierrez. Welcome to my channel. Today I'm going to talk a bit more about the thoracic cavity. This time it's just going to be the bones. I am also going to add the hyoid bone, which is a bone up here, mostly because, well, it fits really nicely, and I figure in this video I'll have a lot of time. Not next week, but the week after next, I will talk about the skull and hope to get through that as quick as I usually get through other systems. And then I'm going to switch gears and go into the kinesiology, the muscle movements, basic stuff for bones. And that way, when we talk about muscles, you'll understand the movements as they come into play with pretty much the muscles. Well, as always, I will answer any question. Feel free to ask it here, or if a couple of people are live, you can ask me here live, and I will answer it right away. And again, I decided to start using my work desk to pretty much as my place to do these. So with that, I do it early. I'm going to talk about the ribs, and I'm going to get my pens out from here. This should hold very good. Actually, I've noticed that this is a lot easier to see. Now, when you're dealing with the thoracic cage, the rib cage, especially the bones, there's a lot of things you really do want to pay attention to. One is you may want to go back and watch the thoracic vertebrae, just that part of the spine, because those are one of the main structures that are involved in the thoracic cage. So you have the thoracic vertebrae, and you have 12 thoracic vertebrae, which is really important because it tells you you also are going to have 12 ribs coming off of that. I actually was teaching a class where someone said, well, don't men have 11 pairs of ribs? And no, they actually do have 12 pairs of ribs, just like women. I don't understand why the story came the way it is. Not my field of expertise, so not going to talk about that. So you have ribs, and in the middle you have your sternum. Your sternum is really 3 bones. Technically 2 bones and a piece of cartilage up until you hit about 35, 40, then the last piece does become bone. Now, if you look here, you actually can see 1, 2, 3 parts. So these are the 3 parts of the sternum. I actually do the clavicle there as well, even though it's involved in the movement of the arm, and I talked about it earlier. By the way, that's why it's called the sternal end of the clavicle. So the first part of the manubrium, the first part of the sternum is called the manubrium, which technically is the knife handle. Then you have the body of the sternum, which is here, and you have your xiphoid process hanging down. Now, if you've done CPR, even the most basic CPR, so a lot of times they tell you, feel the sternum for that bump. That bump is called the angle of Louis, and usually they tell you that's where you want to put your hands for compression. You want to avoid the xiphoid process because that's a part that's usually cartilage until 35, and it's thin, and if it's pressed down, it can break, and it can cause damage to organs inside the thoracic cavity. The thoracic cavity is actually the area inside the chest. You have a couple different cavities. Abdominal pelvic is farther below, thoracic is above. Then they actually do have the ventral body cavity, which is thoracic, abdominal, pelvic put together. We'll deal with those later. Now, as I said, from your thoracic vertebrae, you do have ribs coming off. And I do the ribs here. Now, one of the things you'll notice is I drew some of them, parts black, and then a part here, which is green. The reason I did that is part of what we call the ribs is actually made up of hyaline cartilage. If you go back into the tissues of bones, you'll actually realize that hyaline cartilage has some really interesting function. It's not rigid. It actually can stretch a little, but not too much. It has a little flexibility, and that's actually important for how the ribs function in respiration. Now, like I said before, you have 12 ribs, and those I'm going to actually talk a bit more, and I'm going to go back and refer to the sternum, which is why I talked about that first. So you have 12 ribs, and the first one comes off the first thoracic vertebrae, the last one comes off the 12th thoracic vertebrae. And there's a couple differences with ribs. There's actually a couple of ribs that are called false rib. The 11th and 12th rib, the last 2 ribs, are called floating ribs. They're called floating ribs because they don't make contact with the sternum. They're just floating, and they're usually found way in the back. Remember, they're actually the lower portion of the rib cage. Then you have 10, 9, and 8, which are the false ribs. The reason they're called false is they actually share a cartilage, which kind of comes in with the 7th rib. So the 8th and 7th rib are actually really important, by the way, for a couple other reasons. So these are your false ribs. And then you have your true ribs. And the reason they're called true ribs is they connect directly to the sternum. Now, one rib that's really important is if you feel your angle of Lewis or the sternal angle and go lateral, go to the sides, you actually hit the 2nd rib. And that's important because in clinic, people can actually use that to count ribs. So they can actually determine where certain structures in the body are. Now, the one thing, well, I'm going to talk more about ribs because that's actually significant. The one thing that happens with ribs is you actually, and this is a real elementary drawing, you have a head, you have a little neck area, you have a tubercle, and those are actually attached to the vertebrae. Then you have an angle and it curves forward, the angle here, and then the rib curves forward, and then it attaches to cartilage where it goes to the chest. The ribs are actually not really, they're not fused to the thoracic vertebrae. They're actually connected with cartilage and dense regular connective tissue, which holds it roughly in place, but it does allow it to move. So if you actually take all these things together, it actually allows the expansion and contraction of the chest. So if you watch the last video on how there's a lot of different reasons, different ways that Mr. Floyd passed away, that's actually why that's such a dangerous thing. Now, a lot of the danger with the thoracic cavity has to do with the organs inside. We'll get to that later. Now, we have the ribs. Now, usually ribs will break at an angle, and any rib can break. But usually, the ribs that break are not the floating ribs. The floating ribs are actually pretty hard to break because they're covered with muscle, and they're really in the back and hard to get to. So you do have a lot of people who don't speak, who don't understand anatomy, don't have the basic understanding of anatomy. We'll talk about the floating ribs, and they'll usually point up in front. They are correct, though, to say that the ribs up in front that protrude more, which are ribs 7 and 8, are the most fractured ribs in the body. And the reason is they protrude more. So usually they do break because of people running, colliding into something, falling. It does happen, but any of these ribs can break. And the problem with breaking a rib, like I said, is you have your lungs here, you have your heart here, and so you can end up having a lot of problems because of that. The sharp rib break can actually puncture any of the organs in here. Liver is over here, by the way. And so it is actually one of the problematic things that can happen. Now, one of the things I actually did realize is that I should mention is people don't really think of trauma to the chest too much, but it's actually one of the more dangerous traumas. Actually, besides the head, it's the second most dangerous part to get injured, mostly because of the organs inside. Remember, if you break something, it can actually wiggle inside and damage what's inside, such as your lungs, your liver, your heart. And so that's actually why the ribs are so important. Now, the other bone I'm actually going to talk about, and I'm noticing that this one is going to be shorter than most, is this that looks like a happy face. It's actually called the hyoid bone. And it's up here. One of the things you'll notice is it's a U-shaped bone, and it has 4 projections coming off of it. These 2 little ones are called the lesser horns. The big ones are called the greater horns. Neat thing about the hyoid is it's not attached to any bone directly, but it is really important, especially for chewing and swallowing. The other thing that's important is something that can happen with certain chokeholds. That hyoid bone can break. Now, what that means is if someone actually comes in with a broken hyoid, we know that the cause is usually strangulation. It could be either from someone actually physically trying to choke them with their hands. There's actually some chokeholds where they grab the shirt and pull it up. There's a lot of different things. I think they call it the lion killer, where you put that can actually cause a fracture and can end up causing a lot of issues later. It can be a medical emergency. The other way is through hangings. So that's pretty much the basics of the thoracic cage. Like I said, next time I'm going to talk about the bones of the skull. But as I do have time, I am going to talk about something I read recently. And that has to do with a lot of magazines will try to touch on the medical aspect. And they don't understand the medical term or why things happen. So recently, I won't mention the magazine, some people have probably read it. There was an article that talked about how people get stress fractures. Now, stress fractures are a specific type of fractures caused by overuse under normal circumstances. Usually the stress fractures are either the fracture of the bones of the foot, which I talked about earlier. Sometimes it actually can happen in other bones, but it's usually not through unusual ways to use the bone. What I mean is, there are ways that the body uses the bones normally. That's actually meant to be used a certain way, and that causes stress fractures. It's actually not the force that's causing the fracture, but the repetitive use of the bone. This magazine actually put the training kicking hard substances with the tibia as a stress fracture. That really shows that someone didn't know the basic clinical anatomy, didn't understand what they were actually talking about. And it's pretty sad in my eyes. That's a magazine that charges people to read it, wouldn't hire the right person to actually put the real clinical aspect. It's not if you break your tibia, it's not a stress fracture. A fracture of the tibia is a traumatic fracture. It's just a regular type of fracture. And so sometimes in magazines, you do see this. You see people who go beyond their level of expertise, and pretty much it really does show a lack of caring by a corporation. I hope you enjoyed this, and I hope you'll join me not next week, but the week after for the skull. I will talk a lot more about fractures. That one I may end up having to break it down into 2 parts. We'll see what happens. Thank you, and have a nice day.